Hello, I'm Dr. Preeti Mrinalini, a general bariatric and a minimal access surgeon practicing in Chennai, Bewell hospitals. Today we are going to discuss about breast lumps, which is a very common issue faced by young women and of course the elderly as well. So in young women, it is generally benign, maybe a fibroadenoma or a benign cyst. But in the elderly, when we notice a breast lump, it's more commonly or more often found to be malignant, and it is better to get evaluated. So in elderly women, that is especially between 30 to 50 years of age, the breast as such gets denser, which leads to more fibrocystic benign diseases also. But when we notice a hard lump, the main thing that we need to check is if the lump is either growing in size and if it is causing any pain, if there is any nipple retraction or any discharge from the nipple. So these are very important signs and symptoms that we need to keep noticing. So how do you self-examine yourself? Stand in front of the mirror, face yourself directly, and first lift your hands up. Check for bilateral symmetrical appearance. Then hold your hands on your hip, right, and contract. Check again if there are any bulges or if there is any nipple retraction as such. Bend over and check if there is any difference from anything normal. So these are the ways to examine yourself. This is look. Next thing you go into is feeling, right? Start from your upper part of the neck, check for any lymph nodes. Go down and examine into your axilla. Check if there are any lymph nodes there. Next, go into your breast region. Go in circular, soft motions. Do not push. If you push, you will definitely notice a lump. That is not the correct way to do it. So go in gentle circular motions and check on either side of the breast if you are noticing any abnormal lump. So in younger adults, it is very common to notice fibroadenoma, which are very small, say firm consistency, and they are very mobile. They keep moving in between your fingers, right? And this is a very characteristic feature of a fibroadenoma, and it is also a very benign disease. So you notice a lump, right? The next step is you visit your general practitioner or your general surgeon. And what we do is we will examine you first and then schedule you for an ultrasound or an X-ray mammogram. This is based on the age difference. The younger adults go for an ultrasound and elderly go for an X-ray mammogram. So the next step is if the report comes out as a simple cyst or a fibroadenoma, so we will grade the disease. And the next thing is wait and watch. Now suppose the size of the lump is more than 3 centimeters, or during the wait and watch period, there is an increase in size, or if it becomes painful. These are definitive indicators for surgical excision. So the surgical incision is a cosmetically good looking incision which will be hidden within the areola region as it heals. Now this specimen will be sent for biopsy to have 100% confirmation on the diagnosis. There are some situations where this biopsy turns back as malignancy, which will need further evaluation. And now these are in younger adults, which is very common. Now in the elderly or say post-menopause or during the menopausal period, the chances of malignancy is much higher. So when we notice a hard lump and also increasing in size, sometimes painful, with or without nipple discharge or nipple retraction, these are indicators of maybe a malignant lump that you are having, which needs immediate attention. So we will progress and do a biopsy after a mammogram that I had mentioned already. So we will do a mammogram followed by a biopsy, and based on the result, further evaluation of the disease needs to be done. So if you notice a breast lump, first, do not panic. Contact your doctor immediately and take the necessary precautions. Stay safe, stay healthy. All is well with Be Well.